The word orgasm is from the Greek word orgasms, which is defined as to swell with moisture, be excited or eager. An orgasm is the buildup of pleasurable body sensations and excitement to a peak intensity that then releases tensions and creates a feeling of satisfaction and relaxation. Orgasms feel generally similar for men and women. The two body parts primarily involved in orgasms, the penis and clitoris, are homologous, meaning they both originate from the same tissue in the developing embryo. Additionally, the spinal cord and brain are connected to the penis and clitoris by the same nerve root, a pair of pudendal nerves. Not all orgasms feel the same. Because the genitals are connected to several different pairs of nerves, stimulating different combinations of nerves produces different sensations. Additionally, orgasms are affected by cognitive, psychological, and pharmacological variables. A blended orgasm is an orgasm that occurs when 2 or 3 regions of the genital area have been stimulated, creating an additive effect. For example, in women, the clitoris is connected mainly to the pudendal nerves, the vagina mainly to the pelvic nerves, and the cervix to the hypogastric, pelvic, and vagus nerves. Stimulating them together can create a more encompassing, blended orgasm. Most researchers agree that Kegel exercises, named after gynecologist Arnold Kegel, increase the likelihood of orgasm. Kegels exercise the pubococcygeus muscles. Men's orgasms stimulate the same area of the brain as heroin in an addict's brain, strongly suggesting that sex can be addictive. Multiple orgasms are orgasms that occur in close succession, from a few seconds to a few minutes apart. Multiple orgasms are more frequently associated with women, however, men can experience them as well. In fact, Chinese documents from 2968 BC describe men's multiple orgasms. Using condoms does not affect the quality of an orgasm. A woman is equally likely to experience an orgasm with or without a condom. If a man is resistant to wearing a condom, partners may consider manual stimulation first. According to Planned Parenthood, 30% of women have had trouble reaching an orgasm. As many as 80% have difficulty reaching orgasm through vaginal intercourse. Orgasms can be elicited from various regions of the body, including the penis, clitoris, vagina, G-spot, cervix, prostate, nipples, breasts, and anus, as well as from visual stimulation, auditory stimulation, and mental imagery. Orgasms do not stop at a certain age. Some people can experience orgasms past the age of 90. The time it takes to reach an orgasm varies considerably. Orgasm also depends on a variety of factors such as age, sexual experience, and drugs. Men typically require 2 to 10 minutes to reach orgasm, though men who experience delayed orgasms may need an hour or more of stimulation. While women typically require a more prolonged period of stimulation before an orgasm, often 20 minutes, some women can have an orgasm within 30 seconds of self-stimulation. While the time it takes to reach orgasm is different for different people, the length of the orgasm itself is more similar. In one study, women's orgasms lasted 18 seconds on average, and men's orgasms lasted about 22 seconds. Another study found that a woman's orgasms last about 3 to 15 seconds, while a man's orgasm is shorter. Approximately 15% to 20% of American women have never had an orgasm. The duration of an orgasm is usually just seconds for both men and women, but multiple factors influence exactly how long it will last, including age, period of sexual abstinence, type of sexual stimulation, and whether the orgasm is from masturbation or intercourse. In one study, 85% of men reported that their partner had an orgasm. However, only 64% of their female partners reported experiencing an orgasm, creating what some sexologists call an orgasm gap. Different religions recommend different times for people to engage in marital coitus, and, presumably, orgasm. For men, the following recommendations were made: 1. Zoroaster, Persian religious leader, once in 9 days. 2. Hindu authorities, 3 to 6 times per month. 3. Solon, Athenian statesman and poet, 3 times per month. 4. The Quran, once per week. 5. The Talmud, once per day to once per week, depending on occupation. And 6. Martin Luther, founder of Protestantism, twice per week. How often a person experiences orgasm varies considerably among different peoples and cultures. Some societies have recommended that men experience orgasm infrequently because orgasms and ejaculation are considered debilitating. Other societies have considered orgasms and sexual activities as highly beneficial for vigor and health. The duration of an orgasm tends to decrease as a person ages. Anorgasmia means lack of orgasm. This condition, where a person cannot achieve orgasm, can affect both men and women. After a man experiences an orgasm, there is a refractory period when they can't have another orgasm, although some men can experience multiple orgasms. The recharge time depends on age, sexual partner, and sexual experience. There is a clear relationship between a woman's age and the likelihood she'll experience an orgasm. In a 1994 UK study of 436 women, 63% of women 35 to 39 years old experienced orgasm during more than half of or all of their sexual interactions. Only 21% of women 55 to 59 reported this frequency. 5% of the younger women, but 35% of the older women had not experienced an orgasm at all. One man reported 6 successive orgasms, with decreasing volume of semen, in less than 40 minutes. Orgasms have been reported by stimulation after male-to-female or female-to-male transsexual surgery. C. Non-genital orgasms have been reported by people who are under the influence of psychedelic drugs. People who experience orgasms often look like they are in pain. In fact, 2 of the brain regions that are activated by pain are also activated during orgasm, perhaps accounting for the curious similarity of facial expressions. Scientists are unsure how the brain distinguishes between pain and pleasure. Female ejaculation is not urine, though women may expel urine during an orgasm. It resembles diluted fat-free milk and has a sweet taste. Although the volume may seem large during an orgasm, the total amount of liquid released during orgasm usually is not over 1 teaspoon, 4 milliliters. For some women, stimulation of the nipples and breasts can increase the likelihood of having an orgasm and increase its intensity. However, in some women, this stimulation has no effect or a negative effect. Orgasms can relieve pain, albeit for only about 8 to 10 minutes afterward. However, even thinking about sex can relieve pain.